Hello and welcome to Diabetes Connections in the News. I'm Stacey Sims, and each week I'll share the top diabetes stories and headlines of the past 7 days. We do this live on Facebook, so whether you're joining me right now or watching or listening after, I'm here to get you up to speed quickly on what's happening with diabetes technology, research, and our community. As always, I'm going to link up all my sources in the Facebook comments and in the show notes at diabetes-connections.com so you can read more when you've got the time. In the News is brought to you by Inside the Breakthrough, a new history of science podcast full of did you know stuff. First off, I want to give you a heads up that the ADA Scientific Sessions is kicking off this weekend. So expect to hear studies from just about everybody in the space. I've got interviews lined up for the main podcast, the longer episodes we do each week. There are usually some breakthroughs, and while you can't really count on it, some FDA approvals seem to come out this time of year as well. So stay tuned and follow the hashtag 2021 ADA. Some legislative news to tell you about. Just last night, the governor of Maine signed a new law creating an insulin safety net program in that state. It allows eligible Mainers to go to a pharmacy to get a 30-day emergency supply of insulin capped at $35. It's modeled after a Minnesota law that was passed last year, the Alex Smith Insulin Affordability. The Alex Smith Insulin Affordability Act. Exactly what eligible means in this case, though, is tough to find, although it looks like everybody with type 1 who has less than a 7-day supply and, with some exceptions, can be used once every 12 months. Mississippi's Attorney General Lynn Fitch has filed a lawsuit against drug manufacturers and pharmacy benefit managers she says are working together to manipulate and inflate insulin prices. She says, quote, "As the mother of a diabetic, I know the emotional, physical, and financial toll the unconscionable price of insulin has on families. These companies are exploiting the vulnerable. I'm fighting back because you should never have to decide between paying the ever increasing price of insulin or compromising your care." The complaint alleges violations of the Mississippi Consumer Protection Act for unfair and deceptive practices, as well as unjust enrichment and civil conspiracy. Starting next year, Afrezza inhaled insulin will be covered by Medicare. It will offer all doses under the 2022 Medicare Part D senior savings model, capping the copay per 30-day supply at $35. Afrezza is the only inhaled ultra rapid acting mealtime insulin in the US. Mankind, the company that makes it, has other assistance programs, but this is the first time it is covered by Medicare. Some updates on the American Diabetes Association's standards of medical care in diabetes. These include more information on heart and kidney disease in type 2 and the studies that we've been talking about for a while about teplizumab. Those show that medication can delay onset of type 1 in high-risk relatives of people with T1D. Diabetes Mine hosted its D-Data Exchange, a biannual gathering of leaders in diabetes technology and innovation. Organizers say the focus was on increasing access, expanding the market for tools like CGM to non-insulin users and consumers, which has been a hot topic lately, and building out education and support. A couple of interesting presentations, including Waveform, a new 14-day wear CGM with a rechargeable transmitter and reusable sensor insertion tool. Levels, which is a consumer CGM product, not just for people with diabetes, and from Nudge BG, diabetes inventor Lane Desbro's new algorithm designed to slightly move or nudge basal insulin in response to CGM data. Quick break. I want to tell you about one of our great sponsors who helps make Diabetes Connections possible. Inside the Breakthrough is a podcast that mixes historical wisdom with modern insight. It's a science show that's also very entertaining. They just wrapped up their first season. I love it. They cover everything from actual snake oil to the actual eureka moment. There's even an episode about the guy who discovered the importance of hand washing in hospitals and how nobody believed him. And this all does relate to diabetes. It's a really cool show. Listen to Inside the Breakthrough wherever you listen to podcasts. Back to the news now. Canada has passed an act to establish a national framework for diabetes. The idea is to improve prevention, management, and research. Diabetes Canada developed Diabetes 360 in collaboration with more than 100 groups and individuals. The World Health Organization recommends every country implement a national diabetes strategy, and since 2013, Canada has been without one. And that is Diabetes Connections in the News. If you like it, please share it and feel free to send me your news tips, Stacy at diabetes-connections.com. Please join me wherever you get your podcasts for our next episode. Now, Tuesday, this is a bit up in the air right now, but I am scheduled to take part in a news conference with Nick Jonas, who famously lives with type 1. I hope to bring that to you. And we are sitting down with Dexcom's CEO next week. So if you have a question you want to ask, post it for me. There'll be a thread in Diabetes Connections, the group. Our current episode out right now is all about the PROTECT trial, hoping to slow down or even stop diabetes in the newly diagnosed. Thank you so much for joining me, and I will see you soon.